is under invasion. We are under attack. But there's a miracle. For decades now, national policy on healthcare in Ghana has been focused mainly on the treatment and management of ill health. This focus has not only put a lot of strain on the meager national resources, but more so on the human resources of the country.
The old paradigm basically had focused on diseases. The fact that you are disease, somebody who is not well, and so the focus is intervening after the event, after somebody has fallen sick one way or the other, and that has really moved the health service not only in Ghana but even in the international community, and that basically is curative centered, medicine oriented. In other words, you get sick, you take your drugs or undergo some other therapies. You get well, and then you go home. But international community and everybody realized around that time, and even earlier on in Ghana, that alone is not enough.
In spite of the many and numerous strategies and policies initiated in the past, Ghana continues to grapple with various health challenges. Malaria continues to be a major killer in Ghana. Infant and maternal mortality rates continue to be unacceptably high, and the 5-child mortality is not the best it could be. HIV/AIDS, though on a seemingly slight decline, is still a societal menace. And recently, the re-emergence of Guinea worm in parts of the country all go to portray the huge challenges that the focus on the treatment and management of ill health poses for the country. It is to change this focus that the Ministry of Health, together with colleagues at the ministry, have and continue to vigorously propagate a new paradigm shift in healthcare delivery in Ghana.
Never had we are glad the hospitals don't say they don't necessarily have it. The hospitals are there for emergency, because if you start having problems, you don't solve that problem and it goes into an emergency. Every disaster, the base is a problem. There's some small problem which you know what they mean. That really matters. Before you realize it generates into an emergency, then you are running around to solve the emergency. In running around, you might end up in a disaster or that is what our bodies are doing. Little things that do. But if I had known about this earlier in life, because when I was a baby, I was like iron. I was down. I could do. They call me the tiger. The pounds of human beings, and if that's how we were trained as a ranger. I don't know if I had known about speech, if I had known about regenerative health, and added in my physical capability to physical exercise, I am out.
In his endeavor to demonstrate the practicability and realization of this new vision, and that of His Excellency President John Ajay Kufuor, Minister Kwasiga encountered what is being termed in various circles as a miracle, that is, the miracle of Dimona.
A young man called me from Israel and said they were inviting me to Israel to come and see the practicality of what I am talking about. I didn't quite, believe or even understood what the person was saying. But when I went on a conference in Egypt, I had a call again, reassuring me that I will see very interesting things if I can come to Israel, to a village called Dimona. So I decided that, okay, let me venture, because I didn't even have a visa. I asked them, how am I entering? Because I don't have a visa. Interestingly, they told me to come, the visa will be ready at the entry point. I went there with two of my directors, and lo and behold, visa was made ready for us. And fortunately, I don't know how the arrangements were made. I met Dr. Alfred Fawundu, who was the head of UNDP here in Ghana sometime. And I met Kwesi Chiado, one of the journalists from Ghana. And apparently they have all been invited on their own merits to come there. So three of us met there. And we saw practical things. In fact, this is a community that has migrated from the US. Some are even from Ethiopia, some from Kenya, Uganda, Nigeria, Ghana. All of them coming together, living in a small community. And we found out that there is no trace of disease in that community. And they were doing exactly what we were talking about in our written documents. That you must eat good food, good nutrient food. You must also have a lot of exercise to make your body very active. And you must make sure that you can reproduce yourself safely without fear of disease or death, or what we call mortality. So I noticed that they had nothing of heart disease in that community, no cancer, no HIV/AIDS. As for malaria, forget about it. It doesn't even exist at all. And I tried to find out what is going on here. They don't even have a hospital. It's not even up to the level of a health post. They have a small area where they do massage and colon cleansing. And then there's a very highly qualified doctor, doctors managing that place. They took me to their reproductive health center where they deliver women who are pregnant. And